are able to work with vaccines and do some talks through that, create and establish new pathways that will bypass any injuries that were done from vaccines, especially with heavy metals and things like that. So we work with them in our office, and we're actually encouraging them to start on that pathway too. We've talked a lot about diet. The only thing he wants to eat is grains. So obviously, you guys know where these kids are sensory or even on the spectrum. That's highly inflammatory. So we're trying to make some major diet changes, and I really think that once we are able to actually do that, he's going to even progress by leaps and bounds even further as we decrease some of that inflammation in his diet. Any other questions? Yes.
What were some little things that you were doing to establish a trust with him?
Yeah, so in the beginning, we weren't, so when mom was coming in for her adjustments, and dad is too, we actually would have him come over and help invest with the little chiro clicker. That's why he loves it so much, is we would actually have him involved in the adjustment with his parents. So we would have him come over to the table, and we would ask for his help in the adjustments. So that started to develop that trust, and then they're coming in pretty frequently. So they're in our office 2 or 3 times a week. So seeing that repetition also really helps. Because in the beginning, he would be really shy and really quiet, and it was amazing to see that he feels at home. Like he starts to sing now when he's in the office, and he just got cool, like go from room to room. And so I'll even point it out to his parents, and they're like, "That's how he is at home." He's like, he feels so comfortable here that he actually feels at home now. He's doing things like he does at home too now when he's in the office. So helping to adjust parents. He gets to pick out a sticker or a treasure from the treasure box each time he gets adjusted, so that helps reinforce and build a positive association with it. Sometimes we've had to pull out the phone and show him, let him play on an app or show him a video, things like that. So those were some of the initial things that we started to do. And then over time, he finally one day just got on the table all by himself. So that was a really exciting day in our office. Any other questions? So let me talk to you guys about something else too. So I didn't have like a PowerPoint or anything like that prepared because I really just wanted to have a conversation with y'all. I consider myself on y'all's level, even though I've been out a little bit longer. I've just had more time to get to this point, to get to, to experience a little bit more. So one thing that I feel like really, really helped me when I was in school, and it's been a really awesome journey to be able to see the manifestation of it all, is setting your intention and setting a really clear vision for yourself in terms of what you want to create. One of the few awesome exercises that I had to do in business class when we were here is we had to actually design our dream practice and put it down on paper. And it was part of our assignment, so I actually did that. And what I first wrote down was that I wanted to start a new yoga studio. I don't know why. That's kind of what I did for the assignment. And I kid you not, when I started my practice, I ended up at Urban Yoga in Fort Worth, and I had a space in that yoga studio. Eventually transitioned into a birth center, and I was there for the last 3.5 years. And then just recently moved into this house in the Fairmount District, which is a historical area of Fort Worth. But in terms of vision and in terms of intention and manifesting that, it's so powerful because I've seen it how it's played out in my life, and I couldn't encourage you guys to do more of that type of work. So looking out into the future and seeing what you want to create will be so powerful for you guys, and being able to see it actually play out the way that you envision it. So I'd love to at some point come back and kind of do more of an exercise on that and what's helped me get to this point. In Fort Worth proper, we are pretty much the only practice that specializes in pediatrics and in prenatal. You have to pretty much drive 20 to 30 minutes each way to find another provider who does the same thing. So our practice has seen tremendous growth, and it's been amazing to serve the community in that way. And we would absolutely love to have any of you guys come out and shadow and see it firsthand and experience it. I can't encourage that enough for you guys to get out of school and be able to see other practices and what you love, what you don't love, which is even just as important. Yes, ma'am.
Can you just talk a little bit about how you prepared yourself to see that many kids when you were in school or once you graduated? Little tips that you've done.
So when I first graduated from college, I actually ended up in a chiropractic office, and I was actually, I'm not sure, I would think you guys would be, Dr. Tracy Wilson in Lubbock. I ended up in an office with him, and so that was actually my first exposure to chiropractic in children and pregnancy. I had no knowledge of it previous to that. So that opened my eyes a lot working with them, and that was just as a CA. I hadn't even thought about being a chiropractor, going to chiropractic school. And so fast forward years later, when I was finally here at Parker, I just got involved with ICPA, and I did the modules. I would, once again, I was shadowing offices. I would go back home to Lubbock, and I would spend time in Dr. Wilson's office, learning from him. And then I've had great mentors along the way. Dr. Autumn Ward, who's in near Deep Ellum, but like Greenville Avenue. She was a great mentor, so I spent a lot of time in her office. I had a baby in Tri-9, so at that point we had Dr. Learman, who we'll no longer have. She was a great resource in the wealth of knowledge, so we learned a lot about her. So it's just really finding out who practices the way that you would like to, and developing a relationship with them so that you can then establish some sort of like a good relationship where you can come and chat in the office, come sit in their office, and just hang out and just kind of absorb from just watching. So I did a lot of that, and then of course once I had Lily, she was my guinea pig, and so we've learned a lot just like being her parents and watching our parents. Yeah, so lots of seminars. That's really the best way. And then just finally when you get out, just being your collective, and then developing those relationships, networking with like midwives and doulas and pediatricians and all of those types of people that will bring that demographic into your office. That's really, really important. Yes, ma'am.
Did you address a lot of children in play?
I adjusted a few, actually not as many. That was actually surprising. I am bilingual, and so I actually was very lucky that I got transferred over all the files for bilingual patients. So most of my patients were Spanish speaking, and had some children, but not enough, in my opinion. So if you have that opportunity, definitely get those kiddos in for sure. Any other questions?
So you do the MCs, yeah, on sensory kids. I'm sure you don't see all sensory kids,
No.
but you use the same analysis approach.
Yeah, in terms of analysis and technique, yes. Of course, then we modify it too for some for other kids. Because then obviously with them we can use drops, we can use the activator. I have another kid who's fully blown autistic. He actually does really well on the table, but he does have to have something to focus on while he's like a video. But he doesn't mind using the activator or the integrator on. He's totally okay with that. Max is just a little bit different in terms of where he was at. Nervous system is just so overwhelmed. The other child I was talking about, he's had chiropractic care since his diagnosis, and so he's been just being worked on and having his body touched. And so, but yeah, who here has not done MC2? So I would love to kind of give y'all a rundown so that obviously so just club, so you can integrate some of that too. So you want to say you want to start supine, obviously, and it's based on leg length checks. So for kiddos, have them lay on their back and don't bend the knee, and you want to see if there is a short leg. And so that short leg size is the area that you're going to check cervical. So either C1, C2, and basically you're just going to go and you'll push in on C1, come back, check for any change, go back up to C2, come back, check for change. The area that produces balance is the area that you want to adjust. And then you can move forward with other listings, such as is it posterior, is it interior, is there need to be a clockwise torque or a counterclockwise torque. And then based on all of that, then you can position them, having them lay on their side, like full upper cervical. I mean, that's just going to be way too much right there, so you do what you can. And then adjust that area. For Max, like you saw, I only use vibration, just my fingertips. And you'll feel the release. You'll feel initially where that resistance is. And as you go in and you're just holding pressure, just holding vibration, then you'll be able to feel the transition of resistance to it just kind of melts away. And it just opens up. So that's really real to see with newborns. It is the most amazing experience ever because they literally will just melt in your hands, and it's so awesome to feel. So yeah, and that's pretty non-invasive to them. They can handle a little bit of vibration there. Same thing. Then you just want to come back, check, and at that point they should be even. So then you want to transition over to prone. Same thing. You want to check for short leg. You want to bring legs up. So it's a little bit like Thompson. Bring legs up. Check for change there. If short leg went long, short leg went shorter. That'll give you your positive or your negative default on that side. And then, so MC2, obviously because it's tonal, you want to check the areas where the spinal cord is actually attaching. And so we're going to check the areas where the dentate ligaments are. So we're going to go right SI, sacrum, tailbone, T12, 6, C7, T1, C2, C3, and then occiput. So basically, you're going down. That's kind of your checklist. And you're going to check to see what area is creating most balance as you go along. Area that creates balance is the area you're going to adjust. You're either going to adjust S to I to S, and then you're going to check for torque. Does there need to be a clockwise torque or counterclockwise torque? And Steve Hoffman says that for this technique, torque is actually the most important part. It adds that third dimension to the adjustment that other techniques only have two-dimensionally, so it makes that much more of an impact on the nervous system. So from there, just make the adjustment, same thing, for Max, wherever it is, I just pull tension there, and then do vibration. And then at the end of it, then I'll do that with the twerking, walk through the twerking, so that you can get the full adjustment, come back and check, and make sure it's even. If there is resistance, once you clear that area, you come back, check, and there's leg is still short, then you're going to check to see if there's another area that needs to be adjusted. But following that same line of protocol. If you come back, legs are bent at 90 degrees, and you bring them back towards the butt, kind of doing like Webster check. And if there's resistance there, it's usually an indication of C1 on the opposite side. So then you want to go back and check on that side too. I love doing cranial work on kids. Obviously with Max, it's something that I don't get to do on a regular basis. It just depends on where he's at that day. So there may be just like a few seconds where I can work on a trials or sphenoid, pretty much what he'll allow me to do at that point. But cranial work makes a huge difference in terms of balancing out nervous system as well and calming things down for them. So yeah, that was a little run through. Questions about any of that? Yes. If it's a sensory kid, I'm gonna start with the adjustment because that's gonna make the most impact. If it's a non-sensory, non-autistic kid, then usually because they all start on their back anyways, I'll hear circles and then I'll do a little bit of cranial work on them. And kids are usually okay with that going on. And then transition them to Any other questions? Yes, ma'am. Like days, yeah. I go out to births sometimes, and so I haven't had to go out to a birth in a while, but I would totally do it on a newborn for sure. And you can actually see change, like lengthwise, even on a 2-day-old. I mean, on infants, you can totally see change. They're on their back. It takes just a little bit of work, but just get them to relax. And most of them are usually asleep. And you can just bring their little legs down, and you can check, and you'll see a slight difference in leg length. And you can even go through and check, and you'll see that there's actual change. And parents love to see that because I show them, and I'm like, see, this tells me that there's neurological imbalance in their system, and we need to clear that. And they see the change of before and after, so for them it's really powerful to see the impact that the adjustment can have, like, in such a short, fast amount of time. So yeah, it's really cool. Any other questions, you guys?
For families that are coming in just with mom and dad, kids, do you kind of just do like a bundle package instead of charging for it?
Yeah, we have, so there's 2 phases of care in our office. There's restorative care and then there's wellness care. So everyone that comes in on first visits, everyone's going to get a scan. So that, along with our consultation and their evaluation on their first visit, is going to determine what level of care they need. Both restorative and wellness, we have family discounts built into them. So first family member is full price, second family member gets 25% discount, third 33% discount, and so on and so on. And then same thing for wellness care. If it's 1 family member, 2 family members, 3, and so on, there's discounts built into those fees as well. So we give them the option. We do the insight scan, so CLA substation. So we have the whole thing, like the static EMG, the thermal, and HRV. And CLAs just come out with that ear clip that now you can actually do HRV on babies. So that will be really interesting to see, just to add another component in terms of the evaluation and gaining more information in terms of how their body's functioning. So that will be really cool for practice. Yes.
You said your husband had just started in practice with you now. Was there any like benefits or challenges having him come into the same areas or the same space as you?
No, not really. He was an associate when we first graduated. I stayed home with Lily, and I was a stay-at-home mom for 2 years after we graduated. So of course he went out and started working immediately. And so he was an associate during that time, and then finally I was at a point where I'd grown that I needed help, and it just didn't make sense for me to have to hire somebody else when my own partner is a chiropractor, and he's always loved working on children, and he's Boaster certified, so we were just like, let's just come together. And so yeah, bringing him into the office was kind of a no-brainer. It's been pretty awesome. And it just adds more of that family dynamic into our office. If there's challenges, of course, because I want to do something my way, and he may want to do something his way. But for the most part, it's great. And you know, we can bring Lily up into the office, and she can hang out, or you know, it's really great. Yes.
So with the CLA Insight, you're saying that you had the rolling thermal, the EMG, and then the heart rate variability.
Yeah.
Are one of those more dynamic in the care that you apply to your families and in the process and
infants, for littles, we definitely use the thermal more. There are practices that use the static EMG on infants. Tissue on, they use, CLA even recommends starting between like 3 and 5 for static EMG because they're just going to move way too much to do an appropriate scan on them using static EMG. So we use the thermal, and that's just giving us the insight in terms of how the organ function is working. And so that's the one that we really use on infants, and then kids less than 3 years old. 3 and up, we start using the thermal and static EMG depending on how well they'll sit for us. And those usually give us really good information.
Are any one of the 3 more vital in the way that you apply your care?
I mean, for an adult, each one is going to give you a different part of the, you know, a different puzzle piece to make the whole picture. So it just really depends, and that's when your consultation and your evaluation really have to come into, because we may have someone that comes in